My mother was a nurse in an ICU back in the early 70s, really as medicine was evolving and critical care was evolving, and I thought what she did was the most fascinating thing in the world. I had some experiences early in my life where I was around patients that were injured, and I thought I really at some day want to be in a position to be able to do something positive in their lives. In 2008, surveys were done of readiness for time-sensitive diseases around Arkansas. And Arkansas absolutely finished last in the country in those surveys. If you were a child injured in a car crash in 2008, your chances of dying were over 3 times the national average. We really had a crisis in the state of Arkansas. And what we do here at Arkansas Children's Hospital was so critical to the improvement of what was going to happen in child health in the rest of the state. So for me, it was incredibly exciting to come here and build our capability and capacity to care for the most injured patients here at this hospital, but also take seriously our responsibility to promote child health throughout the rest of the state. This is the only level 1 pediatric trauma center in the state of Arkansas. So it's really the only hospital that if you have a significant injury, EMS is going to show up and the team is going to be assembled prior to the patient getting there. We often will have reviewed the films, and we have a very coordinated response into the operating room directly if we need to, or into our pediatric ICU. Those are resources that really don't exist anywhere else in our state. I believe strongly as a parent that all families really want to know is that you have their best interest at heart, their child's best interest at heart, that you're going to give your very best at all times for the betterment of their child and their family. And I know that if we can gain those families' trust and be consistent in that, that we can get them into our team's care and end up doing a really good job.